know from a study earlier this year at the University of Waterloo that vaping among Canadian teens is up 74% from what it was in 2017. So, Michael Serapio, good reason to pay close attention in this country. What's happening here?
Well, certainly Health Canada is concerned about vaping writ large, and we have to say that they haven't seen these clusters of pulmonary diseases they've been seeing in the United States, but they're watching it very closely because Health Canada, the agency itself, the ministry, does have concerns primarily around this idea that vaping is harmless, because that seems to be a myth, if you will, that is out there. Yes, vaping can contain less harmful chemicals than tobacco products, but it is not chemical-free, says Health Canada, and the Act can expose users to substances that are harmful. And also, while there are vaping products that do not have nicotine, not every vaping product is actually nicotine-free. People, children and teens can also become addicted to nicotine at lower levels than adults. Nicotine can also affect memory, concentration, brain development in young people. They also affect impulse control in young people and the way they behave. So concerns around that. And as for long-term effects of vaping, well, Health Canada is really clear about this. We don't know. This is a new practice. We have not had the benefit of history to see what the long-term effects are. So that is part of the message they're putting out there. Not only Health Canada, but certainly the federal government wants to tighten the rules around vaping. Now, right now, you can't sell vaping products to anyone under the age of 18, but really that's where it ends. And it's very uneven as to how it is conducted in the other parts, different parts of this country, rather. Things like advertising, things like the different flavors that are available to young people. So to try to tighten up the rules, the federal government is looking at some new laws here. And part of that was a consultation that ended in May. And take a look at the interim summary out of that initial consultation on vaping. Excuse me, they say that all 13 provincial and territorial governments strongly recommended that immediate regulatory measures to reduce youth uptake of vaping products. They suggest that all forms of vaping, advertising, promotion restrictions should align with those in place for tobacco products. So, you know, the average consumer might make the distinction between vaping and tobacco, but certainly the governments across this country believe that the two should be regulated the same way. And part of the tightening of the laws we could be seeing in future, Heather, are things like prohibiting the promotion, manufacture, and sale of certain flavors, specifically flavors that appeal to young people, restricting the concentration and the delivery of nicotine, restricting packaging and online sales. So a lot of concerns around this. We actually heard it in Christine's piece there from Dr. Kolb from McMaster University, saying that they don't want to make the same mistake that they made with tobacco 50 years ago, where they underestimated the health impact that was going to have. So people want to take this quite seriously, not only Health Canada, but also third-party players out there. Although there is a federal election in the fall, so the concern now is that we are still a couple of years away from actually having tighter rules around vaping.
It's interesting, in reading about this, Manitoba's Lung Association, Ontario's Lung Association, just two, talking about this, warning people about vaping. It is top of mind, and this kind of study is likely to get things moving along. Absolutely. But as you say, not there yet. This morning, our top story has been the growing concern about teens and vaping. Investigators with the Centers for Disease Control in the United States are looking at a sudden flare-up of teens often requiring critical care. 94 cases of lung illness this summer alone. Doctors here in Canada are watching as well. We know the number of people who are vaping, particularly teens, is skyrocketing, up 74% according to a study released just last year, as a matter of fact. So as we talk about that, let's bring you some expert opinion. Dr. Martin Kolb is with me this morning. He is the McMaster Chair in Respiratory Medicine, the Director of the Division of Respirology at McMaster, and he's with me in Hamilton this morning. Dr. Kolb, thank you for the time today.
My pleasure to be here.
Let me review the facts that we know of this so far. The CDC investigating, as I mentioned, that cluster, 94 cases in 14 states, mostly teens and young people with coughing, shortness of breath, fatigue, some very serious breathing difficulties, may be linked to vaping. When you apply your medical expertise to that, what might that signal? What might that raise for you?
Well, I mean, first of all, these symptoms are all very unspecific. When you see a patient presenting with these symptoms, you ask a lot of questions and you wonder why a young person would suddenly have shortness of breath or is fatigued or even needs ventilator support, as in some cases in the ICU. So typically you would suspect infections, and yes, we all see these movies and we hear about the stories and we have experience from the past, from SARS, and this is what CDC would investigate at first. That's as per news, and that's the only source I have not been the case. But then you ask for other things, and obviously lots of these teenagers have reported that they have been vaping for a while, and that just rings the alarm bells in any doctor.
That's what they seem to say. They're not making the causal link definitively, yes, but they're saying maybe tied, maybe linked. Interestingly, though, there hasn't been any similar occurrence, according to Health Canada, in Canada. Why would that be?
Well, I think it, as I said, because it's so unspecific, the physicians who see these patients may not really have thought about it yet, but given the news, they will certainly ask more specifically about vaping habits. And there may well be cases as well reported in Canada.
Are you seeing anything in your practice, or are you hearing anything specifically about this when you have discussions with your colleagues?
No, I haven't heard anything yet. We had a discussion since these news emerged, and we have modern times, so all the doctors on call are linked through a WhatsApp group. And typically we share information like this on that WhatsApp group, and so far we have not really heard anything.
But as you say, this information from the CDC may prompt conversations or prompt different ways of reflection. What are your personal concerns about vaping and young people?
Well, to put it simple, you should not vape. Yeah? I mean, the lungs are not made to breathe in stuff that's dirty or smelly, or, I mean, anyone who walks around a polluted city doesn't like that smell in the air, and our lungs are built in a way to protect us and clean the air and filter them, but on purpose, smoking things, whatever it is, into the lungs, it's just not right. And vaping, you know, the big problem with vaping is that it's really presented as a harmless thing. And that's what industry and supporters obviously do. They say it's maybe not as the best you can do, but it's much less harmful than smoking cigarettes and so forth. And that brings teenagers into vaping. And I mean, you have heard the news before that the numbers of teenage kids in Canada and worldwide who are vaping are just going higher and higher, with 50, 60, 70% growth each year.
We don't have the long-term study, do we, to know what the real health impacts are long-term of all of this. And you said something very poignant to Christine Birak, who's one of our health reporters, from her report we've been airing this morning, how we don't want to repeat the mistakes of how we deal with e-cigarettes and vaping, the mistakes of how we dealt with tobacco and cigarettes. What do we have to do differently?
Well, we have to learn from the past, and I think 50 or 60 years ago, if you have some news pieces that you read from that time, it was basically said the same thing. We said that I did not see anyone literally dropping dead after smoking a cigarette. And no, of course you don't, because it happens many, many years later. And these studies have been done in regard to smoking, which is unquestionably harmful. And if you listen now to the supporters and the societies and groupings that advocate for vaping as a safe method to smoke, they say it's not harmful, and there were no reports so far on long-term harm. There's no long-term harm study because there's no long-term use yet. Yeah? But one might just hope that we have learned from that in the past, the regulators have learned from that in the past. And yes, selling vaping devices to teenagers is not permitted. That's at least the first step. But I see these cases that are reported now, whether they are truly linked to vaping or not, certainly having the benefit that it rings the alert bell and it makes people aware that vaping can cause harm.
Well, certainly, I mean, regulation's not in place yet in Canada, but everyone is aware of this study, it seems, as we speak of it today, and perhaps paying even more close attention after what the CDC is looking at. We appreciate your guidance today, your expertise in all of this. Thanks, Dr. Kolb.
You're welcome.
In Hamilton there, Dr. Martin Kolb, respirologist, director of the division at McMaster University.